The homeostasis imbalance of red blood cells is what you call anemia. We all know that anemia is the lack of blood, and it is a decrease in the oxygen carrying ability of the blood. And we have these two reasons, or maybe the result of anemia. The first one is the lower than normal number of red blood cells, and the second one is the abnormality and deficient of hemoglobin content in the blood. And we have these several types of anemia classified as microcytic, which means the decrease in red blood cells. The second one is the normocytic, then adequate hemoglobin content, and the third one is the microcytic, the abnormality of hemoglobin in red blood cells. And we have this one type in which we call sickle cell anemia. This sickle cell anemia is when the body does not form normal hemoglobins. Instead, abnormal hemoglobin is formed that becomes spiky and sharp. And ang form ng anemia is like a crescent moon. Not, dili siya full circle, diba? As we all know, circle ang red blood cells na naimurag lump sa tunga. Pero ang kaning sickle cell anemia kay mura siya og kinuhaan or half na red blood cell. And this is to rupture easily and to dump up small blood vessels which interfere with the oxygen delivery. Also, sickle cell anemia occurs chiefly in the dark-skinned people, mostly who live in malaria belt of Africa and among their descendants. And we all know the difference between dengue and malaria, which malaria is very dangerous kay mo-decrease jud ang imuhang red blood cells due to the malaria-causing parasite stick to the capillary walls and lose potassium, which is an essential nutrient for survival of parasite. And this disease can be prevented if the individual has multiple amounts of red blood cells and then a healthy, or the person or the individual is taking good food and having enough rest. And only individuals carrying 2 copies of the defective gene have sickle cell anemia. And those carrying just one sickling gene is what you call sickle cell trait, which means they generally do not display the symptoms but can pass on the sickling gene to their offspring.
Good morning, Sir Gilly. Good morning to you all, classmates. First of all, I would like to congratulate everyone for surviving the COVID-19 pandemic, thanks to the one and only leukocytes, our defender. Alright, so let's talk more about white blood cells, or let's get to know more about white blood cells. White blood cells, also known as leukocytes, is responsible for protecting your body against any type of infections. So basically, white blood cells are the defender in your body, or the army inside of your body. They do not transfer oxygen, they do not carry oxygen, but they do fight pathogens inside of your body, or any bacteria, or a known organism. Now, in locating those sites of infections and fighting those unknown organisms inside of your body, they go onto different processes. So the first process would be the diapedesis. So diapedesis, they're able to slip out in our blood vessels, and it's also the coming out of our white blood cells in our blood vessels. And the ability of the white blood cell to locate the site of an infection is what we call the positive chemotaxis. Positive chemotaxis, wherein they respond to a certain chemical that causes the infection, and then after that, they locate the site of an infection through an amoeboid motion. So what is an amoeboid motion? Amoeboid motion is a crawling-like motion. And then they gather around on that infection, and then they kill it. Boom. So that's how they kill an invader inside of your body, or an unknown organism inside of your body. Now, we have learned the process of how they fight germs inside of our body. Let's get to know more about white blood cells. So first is, where are they located? They are located on our bloodstream. Since they travel through our bloodstream, of course, they will be located in our bloodstream. And then the next question is, what do they look like? Contrary to their name, white blood cells are colorless, but they can appear pale pink or purple once they get tested on a microscope. Because sometimes medical technologists might use dye to test the white blood cells and what's inside of the white blood cells. Okay. And then the next question would be, how big is white blood cells? White blood cells are extremely small that you need to use a microscope in order for you to see the white blood cells. And next thing is, how many white blood cells are in our body? So overall, our body only consists 1% of our white blood cells, as there are more erythrocytes or red blood cells in our body compared to white blood cells. Okay, so the last question would be, how are they being formed? So they're being formed in our red bone marrow, and then they morph from a little cell, or from basic cell, morph or transition to another type of cell, which is white blood cells, and that's how they're being made. Yeah. And by the way, the normal count of our white blood cells is between 4,000 to 11,000. If it goes up or if it goes high, it would be homeostatic imbalances, which will be discussed on a different or in another video. So yeah, that's all about leukocytes. I hope that you learn something, and I wish you have a great day and a Merry Christmas. Sir Gilio, you take care, and more power to you. Goodbye.
And we also have this called polycythemia, which is an excessive amount or increased number of erythrocytes, or commonly known as red blood cells. Polycythemia may result from bone marrow, bone marrow cancer and can be a normal physiologic response to living at high altitudes where the air is thinner and oxygen is less available. So kaning polycythemia kay this is where ang blood flow kay slow, and there is possibility nga magka-blood clot ang person nga naay too much red blood cells. And platelets occasionally participate in illegal blood doping, which is the infusion of a person's own red blood cells back into their bloodstream to artificially raise oxygen carrying capacity. And the major problem from that results, the excessive numbers of red blood cells, is increased blood viscosity, which means the causes of blood to flow sluggishly in the body and impairs circulation. So meaning dili jud tarong ang flows of blood, and it is very dangerous for our health.
Granulocytes are a type of white blood cells that has small granules inside them. These granules contains protein. There are three types of granulocytes: basophils, neutrophils, and eosinophils. Basophils are the rarest of WBCs. They are part of immune surveillance. This means they have the ability to help detect and destroy some early cancer cells. While neutrophils help prevent infection by kicking, digesting, or warding off invading particles and microorganisms. Eosinophils are the movement to inflame areas, trapping substances, killing cells, antiparasitic and bactericidal activity, and participating in immediate allergic reaction.
Next one is the agranulocytes. It is the second group of WBC, and it is the absence of granules in the cytoplasm. When we say granules, it is the small spot of cytoplasm when the cell is examined in a microscope. And to determine what looks like the agranulocyte is using microscope, is there is nuclei in closer to the north, that is there is spherical, oval, or kidney shape. So makadetermine tayo sa naong sa agranulocyte using microscope. So ang agranulocytes is opposite sa granulocyte kay ang granulocyte kay naay granules sa cytoplasm, while ang agranulocyte kay walay granules sa cytoplasm. And the agranulocytes includes lymphocytes and monocytes. The first thing I have to discuss is the lymphocytes. Lymphocytes have a large, dark purple nucleus that occupies most of the cell volume. So to determine what looks like the lymphocyte is a dark purple siya, makita natin sa microscope. So kung determine ta nga, lymphocytes ay dako siya and dark purple. So it is found in lymph, which promoted the name lymphocytes. So makita sa lymph na mo siya gitawag lymphocytes. So lymphocytes help your body fight against infection and diseases. So there are two types of lymphocytes, which is B lymphocytes and T lymphocytes. So B lymphocytes produces antibodies. So T lymphocytes are involved fighting tumors and viruses via direct attack. So ang B lymphocytes kay antibodies na produce, and the T lymphocytes direct attack sa mga tumors and viruses. So lymphocytes tends to take up residence in lymphatic tissue such as the tonsils, where they play an important role in the immune system. So ang lymphocytes kaya mo fight against diseases and infections. So big help siya sa lymphatic tissue such as tonsils. Yung tonsils isakit na din sa anang parilatpit na tuwa. So big help ng lymphocyte para mo fight against diseases of infections sa tonsils. And lymphocytes are the second numerous nucleus in blood, containing 25% to 45% in WBC. And take note, if your lymphocytes is high, there is a viral infection and inflammation. And if your lymphocyte is low, there are bacterial infection and chronic infection. So now we're going to tackle the monocytes. So monocytes have the largest of the WBC and play an important role in the immune process alongside with the other white blood cells. So it takes some important roles in the process guy. It plays both role in inflammatory and anti-inflammatory that takes place in the process of immune process. And then when they migrate into tissues, they change into macrophages with huge appetite. So micro, large means large. Page one that eats, so big eater siya. So combination macrophages to big eater. So naiduha ka type ang monocytes, which are the macrophages and the dendritic cells. So when we say macrophages are the first line to defense against germs, and the dendritic cells, it is the system cells, the battles against germs. So kakalainan nila ang macrophages ang defend sa mga germs, while ang dendritic cells mo siya mo fight or battle sa mga germs or mga pathogen. And for you student like me, and ako'y tip or clue para mas maingon gumanin ninyo under sa granulocytes and granulocytes. So take note ninyo, never let monkey eats banana. So, ang never let monkey eats banana. So, N means neutrophils, L means lymphocytes, M means monocytes, E means eosinophils, and B means basophils. So, this, hindi makatabang ni para maka-determine mo what are the types of the granulocytes and agranulocytes. So we're down to the last form elements of the blood, which is platelets. So when we say platelets, platelets are not technically cells. They are fragments of bazar of multinucleate cells or larger cells called megakaryocytes. So when we say megakaryocytes, it gives rise to platelets in the red bone marrow and responsible for everyday production of billion platelets in the bloodstream. So megakaryocytes develop from hemocytoblasts in the red bone marrow. So when we say hemocytoblasts, it is the stem cells in the red bone marrow or blood cell former. So ang hemocytoblasts siya ang stem cells na naa sa red bone marrow siya ang blood cell former to produce platelets. Platelets become sticky and clump together to form platelet plugs. So when we say platelet plugs, it is the first step to stop the bleeding. Platelet plugs that close and break steering blood vessel, they are also initiate the formation of blood clot. Platelets' major function is to stop and prevent bleeding and a major role of normal blood clotting. So if you get a wound, for example, platelet helps to stop bleeding. So platelet mismo ang mo help para or responsible para dili na magsigig dugo ang atong saman. So when there are damage in blood vessel, ang atong lawas mismo mo ingon sa platelets or signal platelets para maadto sa mga damage or wound area. And when the platelets arrive sa mga nasaman sa damage area, they stick together to form clot to help stop bleeding and prevent bleeding in the damaged area. And the accuracy of the blood is 150,000 to 400,000 cells per cubic millimeter, but the normal platelets count blood is 3,000 cells per cubic millimeter.
Since we already know the components of blood, now I will be discussing how blood cells are formed. Hematopoiesis is the blood cell formation. So to know this, hema means blood and poiesis means formation. So hematopoiesis occurs in the red bone marrow and in the myeloid tissue. In adults, this tissue is found chiefly in the axis skeleton, in the pelvic girdle, in the proximal epiphysis of the humerus and femur. In children, this tissue occurs only or found chiefly in the long bones only or the femur and the humerus. Always remember that each type of blood cell is produced in different numbers in response to the changing body needs or the different stimulus. Overall, the body or the red bone marrow produced 100 billion of blood cells every day. All the formed elements arrive from a common stem cell. This stem cell is called the hemocytoblast. Hemocytoblast has two daughter cells, the myeloid stem cells and the lymphoid stem cells. In the myeloid stem cells, they produced erythrocytes, platelets, monocytes, neutrophils, eosinophils, and basophils. While in the lymphoid stem cells, they produce only lymphocytes. Now we are done talking about the blood cell formation. Now let's move on to a specific one, which is the red blood cell, or the formation of the red blood cells. Erythropoiesis is the formation of the red blood cell. Erythro meaning red, and poiesis meaning formation. When you combine these two together, the formation of red blood cell. Now, do you know that red blood cells are anucleate and they don't have nucleus? As they age, RBCs become rigid and fragile. So after 100 to 120 days, they will be dead. So phagocytes are there to eliminate the waste of the red blood cell. So phagocytes are found in the spleen, liver, and other tissue. So this is like we call graveyard of erythrocytes. Now, not all components of red blood cells are eliminated. They are reused, and they should be egested from the body. Now, we all know that hemoglobin is the component of blood which carries oxygen, right? Though when blood cell died, hemoglobin is broken down into heme and globin. In heme, the iron of hemoglobin is bound to ferritin in the liver, which are used for future purposes. In bilirubin, which is pigmented, it transports into the liver, which can be used also to synthesize bile. And after that, the liver cells transports the bilirubin into the intestine, and it become brown substance, which is the feces. And in globin is broken down into amino acids, which can be used for protein synthesis. Lost blood cells are replaced more or less continuously by the hemocytoblast in the red bone marrow. The developing RBC contains nucleus and other organelles, and they begin synthesizing huge amount of hemoglobin. Once enough hemoglobin has been accumulated, the nucleus and the other organelles are ejected inside the red blood cell. So that is why we view the red blood cell as a biconcave, and the center and its center is depressed due to lack of nucleus and other organelles. Now, not all red blood cells are ejected from its body. The rough endoplasmic reticulum remains, and the developing RBC is now called as the reticulocyte. Reticulocyte is now transported into the bloodstream. After 2 days or within 2 days, rough endoplasmic reticulum is now ejected in the reticulocyte, and the red blood cell becomes mature and now called as the erythrocytes. The entire development process from hemocytoblasts to the mature red blood cell, which is the erythrocyte, happens 3 to 5 days. The rate of erythrocyte production is controlled by the hormone called erythropoietin. Erythropoietin is found in liver, but majorly it is found in the kidney, and kidney plays a major role in production of erythropoietin. For an example, when the blood oxygen level declines, the kidney, which is the organ that detects the stimuli, produces erythropoietin, produces a hormone called erythropoietin. Erythropoietin then travels into the red bone marrow, and the erythropoietin triggers the red bone marrow to produce lots of blood cells, or specifically the red blood cells. As a matter of fact, ang overabundance ng erythrocyte kay makapadepress ni erythropoietin. Kay tungod, ang ato ang body kay daghan og red blood cell. So si erythropoietin is dili na siya need para magpa-trigger ng red bone marrow para mag-produce daghan pa nga red blood cells. But always remember nga RBCs are not controlled by the relative number of red blood cells inside our body, but by the ability of the red blood cell to meet the body's demands.
Next, let's tackle about the formation of a white blood cells. So first, where does the white blood cells form? So the white blood cells are formed in your bone marrow. They are stored in your blood and lymph tissues because some white blood cells called neutrophils have a short life than a day. So your bone marrow is always making them. So your white blood cells or leukocytes occur in a soft tissue, and that's the main reason why leukocytes or white blood cells occur or formed in your bone marrow. The formation of leukocytes or white blood cells is called hematopoiesis. Your white blood cells is lack of hemoglobin and capable modality to defend your body against infections. So, like erythrocyte production or red blood cells and the formation of leukocytes or white blood cells and platelets is stimulated by the hormone. This colony stimulating factor CSF and interleukins not only prompt red bone marrow to turn out leukocyte, but also enhance the ability of a mature leukocyte to protect the body. And it's also marshal up an army of white blood cells to ward off attack by enhancing the ability of white blood cells or leukocytes to protect the body. Apparently, they are released in response to specific chemical signals the environment, such as inflammatory chemicals and certain bacteria and their toxins. So the hormone thrombopoietin is produced by the liver, accelerates the production of amiga-karyocytes. But little is known about how the process is regulated. So the word thrombopoietin is produced by the liver, accelerates the production of platelets came from the amiga-karyocytes. The thrombopoietin is also known as a amiga-karyocytes growth and development factor. Thrombopoietin is a glycoprotein hormone which produced by the liver and kidney and regulates the production of platelets. It stimulates also the production and differentiation of amiga-karyocytes.
So you get a cut and you start bleeding. But after a little while, the bleeding stops. And that stopping of the flow of blood is what we call hemostasis. Hi, my name is Riza Vansadal, and I'm going to tackle about hemostasis. When you get a cut, this causes damage to the walls of the blood vessels in that area. And as a result of that, blood are going to escape through that damaged vessels. And that's how you experience bleeding. And we do not want that to happen, so we have to prevent that from happening, because it may lead to excessive blood loss or maybe death. And we want the tissue to actually heal. And hemostasis can do that. So what is hemostasis? Hemostasis means the stopping of bleeding. The hem in hemostasis means blood, and the stasis means standing still. When does it occur? If a blood vessel wall breaks, a series of reactions starts the process of hemostasis. So if masamad gani ka, mastart na lang ang hemostasis. Now, these hemostasis involves 3 phases. First is the vascular spasm, second is the platelet plug formation, and the third is the coagulation. Let's break this down individually. And now, let's deal with vascular spasm first. What is vascular spasm? Vascular spasm. This is also called vasoconstriction. Now, if we look at the structure of the walls of our blood vessel, we see that the middle layer contains smooth muscle. Now, anytime you see a muscle, in mind that contraction can happen. In this case, in response to the damage of the blood vessel, the smooth muscle layers will actually start contracting, and that is what we call vascular spasm. Why did that happen? When there's a cut, there are pain receptors. They release chemicals in that local area. Also, the cells that are lining the inner layer of the blood vessel wall release chemicals. Those chemicals will cause the smooth muscle to contract, and that action will help them to restrict the flow of blood. It's like when you're holding a hose, and when you put pressure on holding it, or when you're holding it tight, you are limiting the flow of water. It's the same thing as vascular spasm. It basically slows down the flow of blood. Then we have the second phase, which is the platelet flag formation. So what is it? It is an accumulation of platelets that can seal up a small break in the blood vessel. When the underlying collagen fibers of a broken vessel are exposed, the platelets become sticky and cling to the damaged site. Anchored platelets release chemicals that enhance the vascular spasm and attract more platelets to the site. As more and more platelets pile up, a platelet plug forms. Essentially, we have these platelets that are in the blood, and they're freely traveling through the blood vessels for moments just like this. Well, when there's a damage to the blood vessel, it exposes the underlying connective tissue and collagen fibers that's normally in the walls of the blood vessels. And as the platelets are passing by minding their own business, they get activated and they change their shape. They also will release granules, and as a result of that, they become sticky. So they clump together around the damaged tissue to form what is called a platelet plug, since magkadaghan man sila, kaya mo attract sila og laing na platelets. And that is what we call the platelet plug formation. This is a kind of like a temporary internal band-aid that's helping to stop the flow of blood until we can have something more permanent. So the third phase and the final process is the coagulation, also known as the blood clotting. This results in a formation of blood. Clot simply means a network of thread-like protein fibers called fibrin that traps blood cells, platelets, and fluids. Coagulation. Now this is the process that involves a complex cascade of events. This involves a bunch of clotting factors, but the main goal in here is that it is to form a fibrin mesh that holds everything in place, holds the platelet blood formation in place for the healing to essentially happen, or to take place. The yellow thread, or the thread like what you see in the picture, is what we call the fibrin mesh. Here's a simplified look at how this happens. I mentioned earlier that this process involves a complex cascade of events. In that cascade of events, there are two pathways involved, an intrinsic pathway and an extrinsic pathway. They both involved various clotting factors, but they lead to the common pathway. First, the intrinsic pathway gets activated as a result of the damage to the walls of the blood vessel, hence the name intrinsic. It's a pathway that's within the blood vessel. While on the other hand, the extrinsic pathway happens as a result of the damage to the extravascular cells, those that are not part of the blood vessels. They are outside the blood vessels, hence the name extrinsic. Now, both of those pathways lead to a common pathway, as what I've said earlier. And here's the important part. Well, they are all important, but the key thing here is that the main goal is that in that common pathway, there's an inactive enzyme called prothrombin that gets converted to active enzyme called thrombin. And once this thrombin is active, it converts to fibrinogen, which is soluble and inactive, into fibrin, which is insoluble and active. The fibrin strands will form the fibrin mesh, which I was talking about earlier, the yellow thread that's holding the platelet plug together, in order to hold everything in place so that healing can essentially happen. So ultimately, for hemostasis to happen, first we want to slow down the flow of blood, and the vascular spasm accomplishes this. And then we want to get a platelet plug formation, and lastly the coagulation, resulting in a vibrant mesh holding everything together so that healing can take place. And that's it for hemostasis.
Disorder of hemostasis. So as Ms. Ansai said, hemostasis is the process of stopping the bleeding or clot when the blood vessel wall breaks. Ang taning hemostasis, sometimes dili na siya ma-work, which leads into a disorder. This disorder occurs if the clotting is inappropriate or insufficient. Then this disorder of hemostasis has two major. This two major includes the undesirable clotting formation and the bleeding disorder. Sa undesirable clotting, na siya two disorders, which is the thrombus and embolus. Thrombus is a clot in an unbroken blood vessels. If this thrombus will large enough, if not an injury or any certain medical condition, ang clot can block the passageway of blood, or it will slowly the blood from flowing inside your blood vessels. Then if by chance ang thrombus will break free, okay, it will become an embolus. And if ang passageway sa embolus is too narrow, it can cause blockages in your vital organs. So this embolus is a traveling blood clot. Meron siya mo keep flowing sa imong bloodstream nga lead also to a life-threatening situation. Next is the bleeding disorder. So the first bleeding disorder is the most common causes for abnormal bleeding. This is called thrombocytopenia or platelet deficiency. This disease or condition is kanang naa kay low platelet. So iba man ta nga ang platelet is a tiny cells or blood cells nga mo form to help the bleeding stops. Then if naa kay thrombocytopenia, then low kayo imong platelet, it can lead to excessive bleeding. Then it can also be a cause of petechia. Petechia is a purplish na dot na nasa imong skin. The next bleeding disorder is hemophilia. This hemophilia is heredity bleeding disorder or genetic mutations na na-inherit nimo sa imong family. This disorder occurs if any normal clotting is missing, and it can lead to a serious uncontrollable bleeding. That's all.
Blood groups transfusion. Blood transfusion work to replace blood that is lost due to injury, surgery, or to treat medical condition. Blood transfusion is a common procedure in which donated blood or blood components are given to you through an intravenous line, meaning through the veins na sila paagi if mag-blood transfusion o if napakanan kag dugo if nakulangan. Human blood groups have four main blood groups: type A, type B, type AB, and type O. So our blood group is determined by the genes that we inherit from our parents. For example, ako mama kay type O and ang papa is type B. So it's either type O ko or type B. So each group can be either Rhd positive or Rhd negative, which means in total there are 8 blood groups. So before natin ilalakan ang 8 blood groups, ilalakan sa nato ang antigens o antibodies. Antigens and antibodies. So blood is made up of red blood cells, white blood cells, platelets, and a liquid called plasma. So our blood group is identified by antibodies and antigens in the blood. So unsa man yung mga antibodies or antigens? So antibodies are proteins found in plasma. They are part of our body's natural defenses. They recognize foreign substance such as germs and alert our immune system which destroys them. So antigens are protein molecules found in the surface of the red blood cells. So ang agglutination is a phenomenon occurred when the RBC antigens were bound by antibodies in a serum, which leads to clogging of the small blood vessels through the body. So atong ilailangan sa first atong ang antigens and antibodies before mag-agglutination of it. So antibodies antigens. Antigens mo, so mo ni atong red blood cells. Ang antigens kay ma-found siya sa surface atong red blood cells. So mao ni ang antigens. So ang antigens maka-determine siya kung asa ta nga blood group, no. If A imong antigens then type A ka, if B imong antigens then type B ka, if AB imong antigens then type AB ka, if zero imong antigens then type O ka. So ang antibodies naman are opposite siya sa antigens. So if imong antigens kay if ang antigens kay A, then imong antibodies kay anti B, which means mo attack ka siya sa kanang opposite antigens. So if anti-B, then matak siya antigens na B. So, if antigens nimo kay B, then imong antibodies kay kanang anti-A. So, sa type AB naman, duha man ka antigens imong type AB, then wala kay antibodies ana. So, ang type O naman, wala man siya antigens, so kanang duha ka bukiyang antibodies, type A and anti-B. So, example situation. So, if a person with type A na blood gets a type A na blood, then there's no reaction. If a person with type A blood gets a type B blood, then there's a reaction because diba ang type A kay yung antigens kay A, then yung antibodies kay anti-B, yung anti-B kay watak og antigens nga antigens na B, then itagaan man ang type A o person nga type B nga blood. So ang type B nga blood kay na may antigens na B, so kanang ang antibodies niya mo attack siya sa antigens na B sa type B. So magka-cause na siya og clump, then mo-trigger day ang immune system nimo to destroy that. So ma-destroy na niya. Ang una basta mismatch na dugo is life threatening jud siya kay maka-cause na siya clog sa small blood vessels nimo, no. ABO system, there are 4 main blood groups defined. Type A, type B, type
AB, and type O. So, let's review na lang guys. I-mention din nato earlier. So, ang type A is, type A kay na ay A antigens with B antibodies. Ang type B naman is B antigens and with anti-A antibodies. Nya ang O naman is no antigens but both yung antibodies, anti-A and anti-B. Ang AB naman is both antigens, A and B with no antibodies. So, fun fact about it is ang blood group nga AB kay mao ni siya ang universal recipient while ang blood group O is the universal donor. So let me explain. So mao ang AB na universal recipient ang kay wala man siya wala man siya antibodies, so walay maka-trigger sa uban nga blood na mosulod niya, so maong universal recipient siya, while ang type O kay wala man siya kanang antigens niya na siya ka antibodies. So if tagaan nimo ang type O nga person o kanang type B, then iyang antibodies nga anti-B mo react to siya, so dili jud na pwede. So ang compatible ra jud sa O is kanang O ra jud siya. So kung ang type O kay pwede siya maka-donate pero usa ra iyang ma-receive, ang O ra pareha ra niya, while ang AB nga kanang blood type kay maka-receive ra siya og kanang mga uban nga blood group pero di siya ka-donate, no, kay naman siya duha ka book antigens niya, maka-trigger man na silang antibodies, right? RH system, red blood cells sometimes have another antigens, a protein known as RHD antigen. If present ang RHD antigen sa imong red blood cells, then positive RHD ka. If wala, then RHD negative ka. So this means you can be one of the 8 blood groups. So mao na ni ang 8 blood groups na akong gi-mention earlier nga atong ilailahon na karon. So there are 8 blood groups, right? The A positive, A negative, B positive, B negative, O positive, O negative, AB plus, AB negative. So mo ng 8 blood groups. So here are the compatibility with RHD system to another blood. So if belong ka sa blood group nga kanang positive, then ang compatibility nimo kay kanang it's either nasa positive o negative. Well, if na belong ka sa negative nga kanang blood groups, then ang compatibility ra nimo kay negative ra siya nga blood type. So example, ang O plus kay kanang iyang compatibility kay O plus or O negative. Well, if O negative ka, ang compatibility ra kay negative ra sad, so O negative ra jud imong compatibility.
So now let's talk about blood typing. Before we do that, we need to do cross-match with donor to look and see what type of blood to receive and compatible, because everyone has a unique type of blood. There are 8 types of blood and they come from 4 blood groups, which is type A, B, AB, and O. We need to understand the concept of antigens and antibodies. Antigens is a protein that elicit immune response, while antibodies protects body from invaders. Antigens can be found in the RBC except sa type O blood. Kaya walay antigens, that's why ang type O kay universal donor na blood. And type AB is a universal recipient kaya tungod wala siya antibodies. Antibodies is opposite sa antigens. For example, ang antigens RBC is A, the antibody should be B. Kaya if same sa duha RBC, dili ma-compatible kay magka-blood transfusion reaction and ma-end up mamamatay ang pasyente. And we need to see the RH factor present on the surface of the RBC. If these factors are present on the RBC, that means they are RH positive. And if it's not, then it's RH negative. If the person is RH factor positive, they can have positive and negative type of blood. However, if RH negative, they can have only negative types of blood.
So let's proceed with the developmental aspect of blood. Before birth, there are many sites of blood cells formation. The fetal liver and the spleen are the early sites of blood cell formation. During the development of a fetus, blood cells are formed through a process called hematopoiesis. This process begins in the yolk sac during the 3 weeks of gestation and continues in different organs as the fetus grows. In the first trimester, blood cell formation primarily occurs in the yolk sac and the liver. By the second trimester, the bone marrow becomes the main site of hematopoiesis. And by the 7th month of development, the bone marrow is responsible for producing almost all types of blood cells, including the blood cells and red blood cells, white blood cells, and the platelets. By day 28 of embryonic development, the circulatory system begins to form. Blood vessels develop and start to circulate blood in the embryo. This early circulation is crucial for exchange of nutrients and oxygen, supporting the breathing tissues and organs. The process involves the development of both the heart and the blood vessels, establishing the foundation for the intricate circulatory system that will sustain the developing embryo throughout its growth. So fetal hemoglobin differs from hemoglobin produced after birth. Fetal hemoglobin has a higher affinity for oxygen than adult hemoglobin due to the presence of a different subunit called gamma globin. This gamma globin subunit replaces the beta globin subunit found in the adult hemoglobin. The gamma globin subunit has a higher affinity for oxygen because it has different structure
structure that allows it to bind more tightly to oxygen molecules. This higher affinity for oxygen enables fetal hemoglobin to efficiently extract oxygen from the mother's bloodstream across the placenta and deliver it to the developing fetus. Physiologic jaundice results in infant in which the liver cannot feed the body of hemoglobin breakdown products fast enough. The physiologic jaundice occurs in newborns due to the breakdown of red blood cells and the immaturity of the liver. During pregnancy, the fetus produces a large number of red blood cells to meet the oxygen demand. After birth, these excess red blood cells are broken down, resulting in an increased production of bilirubin, a yellow pigment. The immature liver of newborns may not be able to efficiently process and eliminate bilirubin from the body, leading to its accumulation and characteristic yellowing of the skin and eyes broken down, resulting in an increased production of bilirubin, a yellow pigment. The immature liver of newborns may not be able to efficiently process and eliminate bilirubin from the body, leading to its accumulation and characteristic yellowing of the skin and eyes. Physiologic jaundice is a common and temporary condition that usually resolves within a few weeks as the baby's liver matures and becomes more efficient at processing bilirubin. Leukemias are most common in the very young and the very old due to the different factors. In children, the most common form of leukemia is acute lymphoblastic leukemia, which is characterized by the rapid growth of immature white blood cells. The immature cells in children, bone marrow, divide rapidly, leading to the progression of the disease. On the other hand, in older adults, chronic lymphocytic leukemia is more common. CLL is characterized by the accumulation of mature but abnormal white blood cells, which progress slowly over months or years. While the exact reason for the age distribution of leukemias are not fully understood, it is believed that genetic factors, exposure to certain chemicals, and a weakened immune system in older adults may contribute to the development of leukemia. It is important to note that leukemias can occur in any age group, but the incidence is higher in the very young and the very old. Homeostatic imbalance influenced by genetic factors can lead to congenital diseases like hemolytic disease and anemia. These diseases are often caused by abnormalities in blood formation and hemoglobin production, with women and elderly being particularly susceptible. As age increases, chronic leukemias, anemias, and diseases like hemolytic disease become more prevalent. These conditions often arise due to the abnormalities in blood cell formation and hemoglobin production. It's noteworthy that women and the elderly are more susceptible to these disorders. As individuals age, there is an increased prevalence of chronic leukemias, anemias, and diseases like hemolytic disease. The heightened susceptibility may be attributed to a combination of genetic predispositions and the cumulative effect of aging on the body's regulatory mechanism. Understanding these factors is vital